Hello and welcome to Spotlight on Wawarsing. I am your host Christian Holmes, and today's show features Jillian Nadiak-Bruck, Community Engagement Coordinator with the Ulster County Department of Mental Health. Thank you for being here.
Absolutely. Happy to be back in Ellenville.
It's nice to meet you too.
Nice to meet you.
Today we will be talking about opioid prevention in Ulster County, and Jillian has a PowerPoint for us.
Yeah, so I guess I'll take it away. As he mentioned, I work for the Ulster County Department of Mental Health, and I specifically work on opioid prevention. I'm a dedicated person towards this effort, and it's needed, and I'm going to explain that a little bit shortly. So how do opioids work? This is all very scientific, but at the end of the day, I'm going to explain a little bit more about this. So opioids attach to proteins called opioid receptors on nerve cells that are in the brain, the spinal cord, the gut, other parts of the body. They block pain messages sent from the body through the spinal cord to the brain. So where opioids relieve pain, and that's because they sort of insert themselves on these little receptors, and that can actually lead to addiction. So while they can effectively relieve pain, opioids carry some risks and can be highly addictive. The risk of addiction is especially high when opioids are used to manage chronic pain over a long period of time. And why is that? That's because the body gets used to that, and then when you take the opioids away, suddenly your brain doesn't know how to react to the lack of what was there for a while. And when it comes to chronic pain, you still have that pain. It doesn't go away. And when you combine opioids with mental health, they also sort of ease some mental health issues such as depression or anxiety. So when you take that away, it just exasperates it. And also, the body reacts, and it can cause flu-like symptoms. And some folks have said when they've gone off opioids cold turkey, it's not like cigarettes. There's a risk for death if you don't taper yourself off. So if you've been on opioids for a while, it's really important if you want to get off them to work with your doctor, because they can carefully take you off so that you don't have that risk for withdrawal symptoms, which can be very painful. But that's what leads to addiction when you're not supported in that process. When you stop taking the opioids and suddenly your body's reacting and you don't know why, it can be quite a scary moment, and you immediately start taking the opioid again to find that relief, no longer for the reason why you first started taking them, now to maintain a well-being that's just you're looking for that normalcy. So that's why opioids are such an issue and why we're in the middle of an opioid epidemic. So there's more reasons why we're in an opioid epidemic. So first of all, why were they being prescribed in the first place? As many folks know nowadays, but maybe some don't, Big Pharma had a huge corporate influence. They tried to sell these drugs to doctors, say there's no risk for addiction. They tried to say that pain was something that in this day and age is inexcusable. No one should ever be in pain. Therefore, you as a doctor need to take that pain away. So they were prescribing oxycodone, which was pushed by the company that made oxycodone, onto patients for things as simple as getting teeth removed, a temporary pain. But something that folks might not actually know is that it only takes 5 days to develop an addiction to opioids. 5 days. So if you're given a bottle of pills, 120 pills for a tooth removal, and you keep taking them because you still have a little pain on day 5 or day 6, and then you try to get off it, and next thing you know, you're in the bathroom thinking you have the flu, but taking that opioid takes that flu away. That's how the process begins. And when this all first started, people didn't know the risks for addiction. If anything, their doctors were saying you don't get addicted to these. So it's a little bit difficult to manage that. You don't know why you're feeling this way. So overprescribing happened, targeted marketing was happening. The companies were making promotional videos of people who were on oxycodone saying it saved their life from this pain that they had. Where in reality, medicines like opioids should only really be used in end-of-life care, when you know what the end result is going to be, and the only thing you're trying to do is take away that pain in that end of life process. Not for a tooth, not for chronic back pain that you're never going to get rid of. It's really important that you seek alternative methods like acupuncture or massage therapy or physical therapy. And that can be a hard pill to swallow, for lack of a better phrase, because that's a slow process, and sometimes you might not feel like it's taking all of the pain away, but it's better than becoming addicted to a medicine and not being able to get off of it. So stigma's huge. I'm going to speak about that a little bit later in a further slide to provide an example of why stigma has an impact on addiction. So we'll get to that later. Fear and misunderstanding in the medical field. Now that we know what's happening with the opioid epidemic, a lot of doctors are now nervous to prescribe opioids, so they don't. So now you have a whole group of people who have been made to become addicted to opioids who now can't get opioids. And now they're experiencing the withdrawal symptoms, so where do they go? They're going to turn to the street and get an illegal version, such as heroin or fentanyl, which is not regulated and very difficult to manage your own dosing, and it just doesn't go in a good path once you get there. New drugs taking advantage of those suffering from opioid use disorder. What I really want to make sure that people watching today know is that the days of pills and heroin on the street are in the past. Now we're dealing with fentanyl. And as you can see in this photo over here, that amount of fentanyl can kill you. And if that amount of fentanyl is in the heroin or on the pill that you think you're buying on the street, you risk immediate death. And it's important to carry naloxone, and I'll go into that later, to make sure that overdoses like this don't happen. And what I'm referring to right now is harm reduction, and I'll elaborate more later. It's all a vicious circle. There's a lot that goes into this that some might not be aware of. It's not as straightforward as there's people who do drugs and there's people who don't. There's stories behind a lot of substance use disorders. So this is a chart. And this chart has numbers, but what I want to stress is that every number you see on this chart is a person. So this is opioid fatalities in our county, Ulster County, from 2018 to 2022, technically as of January 23rd, 2023. So 2018, we thought was high, 56 fatalities. That's a lot of people. That's when counties really started realizing we have to do something about this. And when we started doing something about this, those numbers went down to 33 people. I want to reiterate that in 2019. 2020, when the pandemic hit, that number skyrocketed beyond the highest number that we had seen so far. We were at 66 fatalities. And in 2021, 71. It's only going up. 2022, luckily we brought that down a little bit, but that's 66 compared to the 56 that we thought was high. Again, every number is a person. Every number is a mother, a brother, a sister, a grandma, an uncle, a friend. So it's very important that we think about this on a human level and not just numbers. But I'm here, I work for the county, and I work with all of our partners on the ground who are doing this work to try to develop strategies. And we have a coalition called the Opioid Strategic Action Team. And under that coalition, we have work groups. This coalition is formed with all of these partners in Ulster County. Step 1, Ellenville Regional Hospital, Catholic Charities, Oracle, with the Sheriff's Department. We have so many, there's like 40 different organizations we work with. So we're all discussing what we're seeing, how can we change this, where we find money to put behind these strategies. I create a newsletter where I communicate things being done, trends to look out for, such as new drugs like fentanyl, but now we're up to xylazine and some other drugs that are getting into the drug supply. I build relationships with our partners so that if I see something happening, I know I can call Samadhi in Kingston because they do holistic work. Or I can call Ellenville because I know they put together harm reduction packages. So I try to tie our partners together, get them to work with each other outside of the normal silos so we're not reinventing wheels, overspending money on the same things, really trying to make the most of what we have. I've created a landscape and gap analysis with all of our partners just to see what we have, what we don't have. Digital storytelling. This is digital storytelling. I'm here, I'm talking to you via television. Strategy and action planning, developing those strategies, putting them in line, seeing how they all work together. Data analysis. I create communications campaigns alongside our partners. There's nothing I do alone. Everything I do is at the result of one of our partner organizations helping come up with the ideas. And then community engagement. I have 2 photos up here. We did movie screenings last year in honor of Recovery Month and Substance Use Awareness Month, just showing movies like Beyond Homeless, Finding Hope, talking about substance use disorder and its impact on the homeless community. PTSD, The Walking Wounded, which was about substance use disorder in the veteran community. And some other films. So really trying to engage folks. I go to chamber events, try to talk with our businesses and get them on board with what we're doing. I'll elaborate more on that, how businesses can get involved if you're watching this. And own a business, there's a way you can help your community. These are some examples of communications campaigns that we did with the Healing Community Study, which was a $2.5 million grant that we received a couple years ago to put behind strategies. So you might see some familiar faces up here. We have Step 1 right in Ellenville, and we did a campaign on fentanyl and naloxone and how that can save lives. Just trying to reach our community. We put it out on social media, and then we studied the impact and how many people we reached, and we were working with Columbia University to really figure out the impact of what we were accomplishing. And here's some other examples of what we've done. We've created t-shirts with some funding, raising awareness and defeating stigma along the lines of naloxone. Naloxone is a life-saving drug. If you are experiencing an opioid overdose, you can take the naloxone spray and spray inside your nose or the nose of someone who you see who is overdosing, and it immediately wedges itself between the opioid receptors I mentioned earlier and the opioid, and it blocks that opioid from going into the receptor, which decompresses the breathing and halts all of those functions, which is what an overdose is. And it can pull a person out of an overdose long enough to get to a hospital and receive actual treatment. And I'll just put it here, you will learn this if you take a naloxone training, but if you do give naloxone to someone and they come out of an overdose, it's very important to call 911 because naloxone stays inside the body maybe for 45 minutes. And if there's enough opioids inside the body that haven't been processed out yet, they can slip back into an overdose. So very important to call medical professionals and get your friend or your family member the help that they really need. But it's an immediate life-saving action you can take. We also have these coffee cup sleeves, which you'll see throughout Ulster County, that have a QR code, just like the t-shirt, that can get you to a naloxone training. And most importantly, not only is it a naloxone training, but most of them aren't in person. You can watch a quick 3-minute long video, and then we have partners that we've provided funding to mail these kits to you, so you can get it right to your door in a couple days. Very important, whether you know someone or yourself. So very important to have that on hand. You never know when you might experience someone. You might be shopping and there could be someone who could be having an overdose. Also very important, I could put naloxone up my nose right now and have no side effects. So you should never worry if you see someone unconscious. Could be a heart attack, could be an opioid overdose, could be literally anything. If you have naloxone and you think for a second it could be an overdose, do not hesitate. You could save someone's life. So I told you a little bit about what I do, but now I'd like to take a moment to tell you why I do it. So this is my brother, Adam Nadiak. He was born June 4th, 1985, and I lost him April 1st, 2016. And he was an Ellenville graduate, 2003. And a year after he graduated, he was actually Army Soldier of the Year for his battalion. He was in the U.S. Army. He served in Afghanistan. He got a back injury and then became addicted to opioids when he came home because he was prescribed oxycodone. and he also had PTSD, post-traumatic stress disorder. And when the opioids take away the pain in your back, but they also take away the pain in your mind, it can be very easy to become dependent on that. So this is why I do the work that I do, because if I can prevent one person from losing their Adam, I will have done my job. So that's Adam Nadiak. Remember his face. And this is why stigma is so important to pay attention to as well. Because in 2016, I didn't know what Naloxone was. In 2016, I was above the influence. In 2016, I didn't understand how someone could become addicted to a medication. And in 2016, Adam didn't know who he could speak to. I did not know that he was struggling for 10 years until I found letters that he had written explaining his addiction and the struggles in his mind that he was going through with his post-traumatic stress disorder. So he was going through it alone, but he had a family who was there and ready and willing to help, but they had no idea that they could. So when your community speaks negatively about something that you're experiencing and have no idea how to escape, it can be very daunting to try to say out loud, I have this problem and I need help. And it's a medical issue. It's been proven that opioid use disorder is like any other disease. It's not something that you can necessarily control if you have parts of your mind that can lead to addiction. Some people can take opioids and be okay. Some people cannot. But it's in our genetics, whether or not we're predisposed to addictive tendencies. We all use our phones. We're all on TikTok for 5 hours a night. That's an addiction. Maybe we're not all on TikTok a night, but it's the same thing. There's tendencies, and one is a medicine, one is more acceptable in our community. So I really want you to think about that and meditate on that, because stigma is still ever present, and what we say can have a really big impact on people that we love. We might not know that they're going through something, so we always want to make sure that the people we love feel like they can speak up. So going back to the work that we do, these are 4 focus areas for our Opioid Strategic Action Team, because we feel these are the 4 focus areas that need the most attention. So primary prevention is youth prevention, providing education in the schools, supporting any needs, making sure that youth know. There's a lot of youth in America dying of fentanyl right now because they go to a party. It's an age-old story. You go to a party, you take a pill once, and you're partying, and then you go off to college and you do whatever you do with the rest of your life. Today, if you take a pill that you think is Adderall or anything, I'm not condoning any of that, but now you might die on the spot. It's very important that our youth know that one time can not only change your life, but it can take your life. So we need to make sure that we educate our children. Recovery-friendly housing, recovery-friendly businesses, recovery meetings. Without recovery meetings in town like Narcotics Anonymous or support groups, we're not fostering recovery if we don't have those things. So we're working with our partner organizations, seeing how we can make sure that every town has some sort of support group. Housing is huge. If you're watching this today, you probably know getting a house, if you don't have one, is not very easy. Getting a house if you don't have a job or transportation or childcare because you're struggling with substance use disorder that prevents you from working, even more difficult. So we're trying to figure out how we can address that for those who are trying to seek treatment or are in that recovery process but now have to build up the foundations of the very basic necessities in life. Harm reduction, we talked about it, I talked about it a little bit before. Naloxone, if you're going to use, you should have naloxone on hand in case you have an overdose. Fentanyl test strips. There are fentanyl test strips available through Ulster County where you can test a drug and see if there's fentanyl in it. If it comes up positive, that's a bad batch. You don't want to use that. You don't want to use heroin at all, but you don't want to use it if it has fentanyl in it too. Even pills. If you have 10 pills, you take one, you crush it up, you use a fentanyl test strip, it might be pure fentanyl. Dealers now have presses where they can press fake oxycodone pills. So even years ago, where people would say, well, it's a pill, it came from a doctor originally, I'm not going to lose my life over this, not true anymore. So very important to test drugs if you have to take them. And I say this as coming back to where I was before. If you don't have access to the drugs that you need, but you're addicted to them, but you're cut off now because of that misunderstanding in the medical community, a lot of people will do what they have to do to get what they need and stay out of a flu-like condition, or even worse, withdrawals that can kill. So some folks, harm reduction until they can get into the recovery that they need. It's important that we can make sure that they can stay alive. Sharps disposal, you never want to reuse the same sharps twice. Or with other people. And education materials. Education is harm reduction. And I like to compare harm reduction to other forms, like a face mask that we wear is COVID harm reduction. We're protecting ourselves from something that can harm us. A life vest, if you go out on a boat, that's harm reduction. In case you fall off the boat, you will be doing harm reduction so that you don't get hurt out there if you can't swim. Same thing applies to drugs. And then we also focus on treatments such as medications for opioid use disorder, like buprenorphine or methadone, which fills those opioid receptors but doesn't take you out of your state of mind, so you can actually go to work. You can get a job. You can maintain how you're living. You can make some money. You can get that car. You're not high with methadone or buprenorphine, but you're not going into withdrawals. And that can be a lifetime medication, or eventually people can wean off that and then not have to take anything. Making sure that that's available in our community is very important. Rehabs are treatment. Crisis stabilization centers are treatment. We're getting one in Kingston. And mental health services. Co-occurring disorders are very prominent. Oftentimes if someone's experiencing a substance use disorder, it doesn't come without the predecessor of anxiety or depression or bipolar disorder. So making sure we really address it as a whole is important. And again, this isn't all me. I just facilitate work groups with the people who are the real experts coming up with the information and guiding these discussions. Our work groups are so important. So I want to go into a little bit about our community. What can our community do to help? It takes a village. And specifically, if you own a business, we have some free items that we would love to provide to you, such as medication disposal packets. I have one right here with little directions to encourage safe medication disposal. I have known people who have lost people to opioid use disorder, and we've gone through their medicine cabinets and found whole bottles of Percocet or oxycodone or Vicodin, and they said, oh, I didn't realize that's what it was, because it was a no-name like hydrocodone or something. I got that from a surgery I had 10 years ago. I never even took one of the pills because I preferred taking Tylenol. You don't want that in your house, because that can lead to other people who can go in and take what they want. If they know you have that bottle in there, they can take one pill and you'll never know. So it's important to dispose of unused medication if you no longer need it. You can host a Nalox box. Well, for going back, if you want medication disposal packets, you can put it at your cashier or set it inside your business. They're free. You just put them out where people can see them. If they want them, they can take them. Businesses are often frequented, so great opportunity to get those out into the community. Now, Nalox boxes are really cool. You can install them in your business next to an AED, the defibrillator, and you just keep Narcan in it. You leave it unlocked. If people are feeling that weight of that stigma and they don't want to take a training, have people know, they can flip open that box, take it. If you just check it every day, if it's gone, we connect you with an opioid prevention provider and they'll bring you Narcan the next day. It's all free. So it doesn't hurt to have one in your business, and it also destigmatizes opioid use disorder by just having it there on the wall. The more people see it, the more people know about it, the more it becomes normal. There was a time where cancer was stigmatized, and I'm hoping that we can get to the point where we can do the same for opioid use disorder. And you can become a recovery-friendly business. And what does that mean? I'll try to keep it short. Being a recovery-friendly business is a business that hires people who are in recovery. They're no longer using drugs. They go to their meetings. They're taking medications for opioid use disorder. And you can get a tax credit up to $2,000 a year for that. But that's not just a tax credit in lieu for hiring someone. It's a tax credit in lieu for hiring someone and supporting them. What does that mean? If they need a little bit of a flexible schedule because they want to go to their recovery group at 1 p.m. in the middle of the day, they can take their lunch, or they can work a little later that day. You're flexible and you can make it work, and you're supportive, and you have that anti-stigmatic environment in your business. So those are 3 ways, and I did it again last time I gave this presentation. I have slides for those. But anyway, so for med disposal packets, we'll go back real quick. Here's some information for you. Just some facts to get you thinking. Nearly 60,000 kids under age 5 go to emergency rooms annually due to poisoning by unsecured medications. And that's not even just opioids. So dispose of any meds you don't need. It's not necessary to have them there if they're expired or if you're not using them. 70% of people with opioid use disorder have taken other people's medications. Diversion, that was the word I was looking for earlier. So if you have a family member that's struggling with opioid use disorder, but you've got Vicodin from 10 years ago in your medicine cabinet, it's not helping. Over 130 people die each day from opioid overdoses. This is in Ulster County, but in the nation. Safely destroy and dispose of unused, expired, or no longer needed opioids at home. Nalox boxes unlocked. You check them once in the beginning and at the close of business. If naloxone is missing, you contact your person, you get a refill, and it shows that you support your community. We have AED boxes. Why not Nalox boxes? Again, totally free, purchased through a grant, through the Healing Community Study and OD2A. It's yours if you want it, if you're willing to maintain it. And I'll give you my contact information at the end. So keep watching. And here it is. So and again, I'm the Community Engagement Coordinator for Ulster County and Opioid Prevention. If you, as a community member, have any questions or thoughts, concerns, suggestions, anything, I'm here to talk to you. The community is who I want to be in touch with. And again, I am but one brain. I have ideas, but I'm sure if you've been impacted by this, you might have your own. You might know what could have helped in your situation that maybe we're not thinking of. So please call or email me, jnad@co.ulster.ny.us. I'm here for you. So thank you for the time. I hope I didn't go on for too long.
No, you didn't. You did perfect.
Thank you.
I actually have a few questions for you.
Sure.
And even though you work for the county, you work in Kingston. Is anyone from Ellenville involved in this work with you?
Absolutely. Ellenville is actually one of our key areas in having so many partners who are involved in our work. So I work for Ulster County. We are based in Kingston.
Yes.
But Ellenville Regional Hospital, I'm actually dropping off a bunch of these t-shirts there today. They do a lot of tabling and events, and they also have incredible opioid use disorder programming. They are like on the forefront of the epidemic, doing all sorts of new and innovative things. They run a whole website dedicated to information on medication for opioid use disorder, everything. They are at every meeting we do. They're amazing. Cannot speak highly enough of them. Step 1 is right next to State Farm, right on 209. They do a lot of work with treatment. Catholic Charities is in the area. There's a lot of people doing really good work here. But Ellenville Regional Hospital, I got a shout out. Big shout out to them.
No, really, big shout out to them too. I have a lot of friends there. My mom used to work there. So,
oh, amazing.
Yeah, it was pretty cool to hear that you're working with a bunch of people from there.
Oh, yeah. And I love working with my hometown. Like, I grew up in Ellenville. I went to school here. So to see organizations here doing such great work in a field that hits so close to home for me, I feel a lot of pride. So, yeah.
Man, I have my own questions here for you, too. So, how could people help their community with drug use and drug abuse in their families and with friends in need?
Absolutely. That's a great question. And I would say, first and foremost, going back to that stigma, just really educating yourself. If you know someone and you know that they're struggling, the best thing that you can do is Google. find out how can I be a supportive person. Anything you want is probably on the internet. But as far as things that I can tell you, carry naloxone. You might be able to save their life. Make yourself aware of resources in the community. They might not be open to hearing about it right now, but you never know when they might turn to you and say, hey, I need a little help. I'm recognizing this is an issue. And you can say, hey, I know that right around the corner, Ellenville has this program. They accept this, and that insurance. Just making yourself aware. Be a social support. And that goes for any kind of allyship. Whether it's an LGBTQ ally or anything, making yourself educated and understanding that community, the burdens they face, just being understanding is what it takes. And if they come to you and say, I'm struggling, to give them a shoulder and say, hey, I'm not judging. We're in this together. Yeah. We're going to tackle this. Don't worry.
Yep.
And having the tools like Naloxone. And you can get that for free, and it's very easy to get. So I can't recommend it enough. I carry it.
Yeah. More on Naloxone. Where could the average person find Naloxone, as in the training to become a Naloxone user?
Sure.
To help out other people.
Absolutely. So here in Ulster County, we've tried to make it really easy for folks. There's a bunch of different options that you can take to find naloxone. But in Ulster County, we've made a website called opioidprevencionnp.org. That's NP as in New Paltz, because the town of New Paltz manages it, but they serve all of Ulster County. If you go there, there's a bunch of different options. And if you scan the QR code on this t-shirt or on the coffee sleeve, you'll find at any gas station, basically, like any of the mobiles in Ulster County, you can get that website. So again, opioidprevencionnp.org. And it has harm reduction information, but on the main page, there's 3 different, maybe 4 different options to get Narcan trained. A 3-minute long pre-recorded video. There's a live session you can sign up for that they host once a month on Zoom. Mm-hmm. And then there's a pre-recorded live session, which is an hour long, which has like data and a Q&A. So if you're really looking for all the information you can find, they really elaborate on that one. So if you go there, you just watch one of them, and then you fill out a Google form, I think it is, and you say, hi, I took this training. Here's my address. And they'll mail it to you in a couple days. So, yep, no reason not to have it.
I have actually 2 more questions for you.
Mm-hmm.
Where can people find the medication disposable packets for home use if needed?
Sure. So if you email me, I'll make sure I get them to you. But they're in random businesses right now. We're trying to get them into pharmacies. You can probably ask your pharmacy. I know that the Catskill Pharmacy in Kerhonkson, I believe they still have them available, and you could just go and ask. They also try to hand them out with every opioid prescription. But as of right now, if you want one and can't find one, I'm not going to send you on a wild goose hunt. Send me an email right up here, and I'll figure out a way to get them to you.
All right, cool.
Oh, I believe you can also text ERH Rescue to 21000, and they'll mail them to you as well. The Ellenville Regional Hospital. They have the med disposal packets.
That's amazing.
Yeah.
All right, yeah.
Free of charge.
All right. And also, do you know when doctors started to realize opioid use was getting out of hand and that police would have to start getting involved with people on the streets who are trying to sell the drugs for bad usage?
Interesting question. So I don't know off the top of my head when they started realizing. But there is a really interesting show, I believe it's on Hulu, called Dope Sick. And it's a dramatized version, but it's pretty spot on. Like, I don't like things that are dramatized because I think it's just like for the shock and awe factor. Yes. But it's a good show. I'd highly recommend it. And you'll learn all about how it started, when they invented oxycodone, when Purdue Pharma decided to start with their weird marketing tactics. But a lot of doctors started seeing their patients coming in before they needed their next prescription and like panicking about it. Like, I need more. And the doctors would be like, well, I don't see why you should be out already. And it's because they were doubling their dose. You develop a tolerance with opioids. That's another big thing, is that you can take one pill a day as prescribed, but suddenly your back starts hurting again. And you're saying, I'm taking the pills. I don't know why they're not working. And then you take another pill. So now you're taking 2 pills, but you don't talk to your doctor about it because he'll probably tell you don't take those 2 pills, but your back hurts. Next thing you know, you're taking 3, and then you're taking 4. And that's how the addiction really starts, because you're just trying to get rid of that pain. So when the patients started coming in and they're gone halfway through the month, they started realizing maybe the people who told us to sell these and who were giving us kickbacks, maybe they were lying to us. And some smart doctors started challenging it. And DopeSick highlights the journey of a doctor who actually became addicted himself after a car accident. He started prescribing himself, and then he took it to the courts and started exposing the situation.
Wow.
Yep.
That's a lot of information to take in right there.
Oh, I highly recommend DopeSick because it's a lot. Even for me, like, to try to regurgitate the information, I'm like, wait, I don't want to get this wrong. It's kind of complicated, but it really was a bad situation, spurred on by a lot of greed. But luckily now, you mentioned the law enforcement. Now, at least in our area, it's, I'm not going to say it's decriminalized, but when police respond to an overdose, they're not arresting that person for having heroin or fentanyl or anything in their possession. When they respond to an overdose, we actually have a team called Oracle, who is a team of a plainclothes officer, a social worker, and a peer. And I believe there's one other person. I can never remember what the actual title is. But they respond to the overdose, and they provide them with the resources they need. Like, hey, do you have Narcan in the house? Are you going to treatment? Are you going to any sort of rehab? Do you want to do any of that? Are you ready for this? Maybe this is why you should. And they really try to help that person get on a path to recovery, instead of just responding like, oh, there's an overdose. Okay, you're going to jail, buddy. We're not doing it like that anymore. We're really trying to take it from a human first perspective. So, and that's another thing I want to highlight with the Naloxone. If you're worried for a second that if you call 911 and someone has overdosed, that you're going to end up going to jail, we have a Good Samaritan law, which basically means if you're in the house and something's happening and someone's life is at stake in regards to this, you're not going to be taken away unless you have like a warrant for your arrest. That's a little different, but never hesitate to call. You're not going to get in trouble for having been around these illegal drugs. The person's life matters first. So I just want to make sure folks know that. Don't worry. Save your friend's life.
Yes, save your friend's life. Everybody needs to know that one. But can residents of Ulster County get involved in this work?
Yeah, send me an email if you want to be involved, if you want to be part of an advisory committee because you have experience with a loved one or with yourself even. First-person experience can inform the work we're doing like no other experience. We work with a lot of social workers and treatment organizations, but they're coming at it from their perspective that they have. To really complete that circle, it's important that we have the first-person experience information. So if you want to offer that, please email me. Or even if you just have any suggestions, if you're seeing something that we're lacking in the community that you think we need, send me an email. Can't do it alone. I promise you that. So please, if you're interested in having your 2 cents be heard, don't shy away from sending me an email.
And also, can you elaborate on stigma? How does it affect your work, and why is it important to try to reduce stigma within themselves or their communities?
Sure. Yeah, so going back to my brother, I think he's a good example of what happens when stigma is in our community. If we treat people with any kind of substance use disorder like they are some sort of other, they're going to feel like an other. I can't imagine being in my brother's shoes. If I had come back from Afghanistan, I served my country, I'm going for my master's belt in karate, I'm doing everything that is like a picture-perfect example of what a person wants to be. But I'm struggling, and I can't get off the pills, it's impacting my work. and I know that I need some help and I'm not going to be able to do it alone. I want to feel as though if I tell someone in my circle that they're not going to get mad at me, that they're not going to judge me. They're not going to tell me, why did you do it in the first place? And again, my brother, it's a picture perfect situation. He was prescribed the pill, he was a vet, all this. But then there's folks who maybe just tried it one time. And that's also fine. To judge someone for one mistake and to condemn them to death is not nice. So it's important to look past these things. We all make mistakes. And if every mistake I ever made sentenced me to a death sentence, I'd be dead. I think it's really important to look at it from that perspective. We all make mistakes. So not every single person has to be out there on a soapbox saying, people matter, but to make sure you're not contributing to stigma by using words like those people are addicts or druggies. Those are words that can really impact a person if they're in that situation. Watching your vocabulary, and it's not a hard lift, and it's all about educating yourself. By watching this, you probably have all the tools you need. It doesn't take a lot.
Can Narcan hurt someone if they weren't overdosing, but someone gives it to them?
Nope. It's interesting because you almost think every single drug has side effects, right? And I'm sure Naloxone probably has some sort of side effects, but there are no side effects that we know about that are highly critical. There's no risk of death with Naloxone. There's risk of death with opioids,
Yes.
So again, you can even give it to children. We don't encourage this, but if a child is accidentally ingested opioids, don't hesitate. If that 3-year-old accidentally swallowed the pills in your medicine cabinet, don't not give them Naloxone. And again, I could probably give myself 6, 7, 8, 9, 10 sprays, and I will be able to communicate just as I am right now. I just might have a really drippy nose because that's a lot of liquid to put up there. So don't ever worry about the side effects with Narcan.
All right. How could I get one of those Narcan shirts?
Yeah, I have a bunch in my car right now.
Okay.
So you can get a Narcan shirt if you like one.
All right, cool.
But they're going out at events. Anywhere you see Ellenville Regional Hospital, they might be keeping them with them. It's limited supply right now, but just keep a lookout. If you're going to events out there in the community that are supporting health and wellness,
Yeah.
you're probably going to see one of the shirts.
Okay.
So Ellenville's getting them, Oracle's getting them, and so is the town of New Paltz because they're all featured on the back of the shirt. So yeah, keep a lookout. Make it a little a fun game. How many events in my community can I attend? That's also how you can decrease stigma. If you go out there into your community, you're involved. You see,
Yep.
you learn your neighbors.
Socialize.
So yeah, you get out there and learn who your neighbors are, and then you can't judge them because you'll probably like them.
Yeah.
So yeah.
I mean, I've been trying to socialize way more in my life, I'm not going to lie.
It's important, and especially post-COVID,
Yeah.
being locked up in our houses can really cause some mental health conditions. So
Yeah, it really can.
I used to be a big extrovert. I know it might seem like I'm one right now, but it's hard for me to get out of the house sometimes. So push yourself, get out there, and you'll start enjoying it again.
Yeah. Well, was there anything that you wanted to share with us today?
I think we got it.
All right, you got everything you wanted to get out.
Mm-hmm.
Well, I think that we're going to close here with this interview.
Awesome.
To call it that. I really loved your PowerPoint and how you set everything up. It was very amazing.
Thank you.
It was very professional slideshow.
Thank you so much.
And thank you for joining us for this episode of Spotlight on Wawarsing, and we will see you guys next time.